Hello, everyone, and thanks so much for joining us today. We know how valuable your time is, and also believe that you'll be really glad that you took this time to join us because we have a really important training for you today on a difficult subject, but one that truly needs discussed and addressed. I'm Rita Wolfson. I am your host for these monthly free webinars. And we have this wonderful guest speaker today. I'm going to let her tell you more about herself when I turn this over to her. Um, I've known her, I've had the privilege of knowing her for a number of years. She actually did a webinar for us previously this year. And when we started talking about the potential to do this one on the financial cost of COVID, sickness, and death, I said, oh, we really need to get this done, not knowing just how important it would be on this day in December. So, just to give any of you who are new some housekeeping information, um, you can check the chat box for any specific messages. Our slides aren't shared because they are proprietary, but the recording will be up pretty quickly on our website, our Facebook page, and YouTube channel. You can type your questions into the question box and we'll answer as many of them as time permits. There are no CEs or certificates of attendance for this webinar, just a really great session with great content. So for those who have been with us in the past or are new to us, I just like to spend a few seconds. Everyone take a deep breath and center yourself because we do know that discussions about money are very difficult, and certainly discussions about COVID and dying and funerals are equally so. Deep breath in and let it out slowly. I like to begin our sessions with our financial social work affirmation that goes like this: just for today, I will love myself enough to face my fears, practice self acceptance, and embrace hope. Just for today, I will silence my inner critics, speak my truth, and make peace with my past. I will give myself permission to eliminate toxic people, beliefs, and behaviors from my life and prepare for a better tomorrow by making friends with my money and with myself today. I really feel that that pretty much captures what financial social work is all about. I'm trying to advance the slide. We know I've been using this slide the past few months, and it feels as if each month the times get more difficult. We have a lot of strong feelings and things happening, a lot of COVID fatigue, COVID anger. A third of people feel that their daily lives have worsened due to COVID. I just also wanted to point out all of the holiday scams. There's a secret sister one on Facebook that is not to be participated in from what I've read. There are coupon scams where you click on the coupon, but it takes you somewhere that is going to take your information and not give you any kind of coupon. So the recommendation is to only purchase from the specific company websites. We know there's lots of package thefts going on around the country, and also pet scams where you get involved with purchasing a pet, which is very popular during COVID, but it's not a legitimate agency. So we're going to start with a poll, and that is how many Americans still have credit card debt from last year. I am going to launch this poll and get us started. Okay, here we go. Okay. Interesting to see. I thought this would be a good poll to start us off with because I am going to give you the answer and see whether or not you're surprised. So 65% of you have voted. Anybody else? Let's see if we can get up to 70%, and then we can keep moving along. And I will show, okay, we are over 70. So let me close it. Let me share with you what you said. And I think the majority of you are going to be surprised. So I hid those results, and the answer is, sadly, that almost 41 million Americans still have credit card debt from last holiday season. If you weren't with us last month, was it, or the month before, we actually did a coronavirus holiday monthly webinar that is on the website if you'd like to watch it. Actually, I guess I didn't. Okay, it's hidden now, I believe. Right, Fonda?
Right. Yeah, exactly. We
Okay.
see your slide now, Rita.
Okay. I had that wrong. Sorry about that. Okay, now they did a poll. What we'd pay extra for this holiday season? Peace and quiet, coronavirus vaccine, friendly customer service, faster delivery, gift wrapping, and look at how many people would pay extra for a coronavirus vaccine, which is interesting because I have one more poll that addresses that. And 31% more young adults than baby boomers plan to be more charitable this year. And 102 million consumers plan to spend less on the holidays this year. So I'm quickly going to give you an overview of financial social work because we know we have many people in attendance who are new to financial social work. And this is where the intersection of politics, the economy, social work, and economic and social justice come together. We cover all of these various important issues. They are always timely, and they seem more timely than ever right now. We know that no one chooses to have money problems, but most people do. That's why we do the work we do. And while no one needs to know everything about money, but everyone needs to know something about money based on who they are, where they are, and what they do. The wellness model is about our relationship with our money and ourselves. That's what makes financial social work so different, and a behavioral model. Our financial behavior is how we earn, spend, save, share, and borrow. And it is what drives our financial circumstances. And we use my little dancing arrow to show you that's where financial health begins and where financial behavioral change happens. So financial social work goes beyond the dollar cents, debt math, budgets, and crisis intervention commonly associated with financial wellness. We do go beyond it by exploring the fundamentals of financial well-being, the thoughts, feelings, attitudes, beliefs, experiences, and values that we all carry with us from childhood so that we can address the financial behavior of earning, spending, saving, sharing, and borrowing. It is an interactive, reflective, and strength-based model. It's educational, motivational, and supportive, holistic, multidisciplinary, healing, hopeful, and helpful. It works as well with individuals as it does with groups. It's about changing our relationship with money, our relationship with ourselves, changing our thinking, and changing our behavior. Most of all, it is about making peace with ourselves and with our money. And I am about to turn it over to our guest speaker, but I have this one poll that I would like your reaction to. I think it's a good segue into Dr. Osby's presentation. Okay, so we do have some strong opinions on this. All right. Okay. Whoa. Great. Wow, you're still voting. All right, I'm going to count it down and then close the poll. So go ahead if you want to vote. 5, 4, 3, 2, 1. I'm going to close it. I'm going to share it. And I find it so interesting. I just added this poll this morning because I was curious. What the news is saying is that 50% of people say they won't get the vaccine. I have to be honest, I'm in the definitely to I will wait and see range. And I can appreciate, which isn't that different than unsure or probably. And it's a lot to think about. We have so much to think about as it is right now. Okay. Am I good, Vonda? Did I close that?
No. Can you hold on, Rita? Okay. Did you hide it? It's closed. Did you hide it?
Okay. I mean, is it hidden?
I'm seeing your COVID. I'm still seeing the poll. So is that your last slide?
Yeah. Okay.
Okay.
Are you seeing me turning it over to Dr. Osby now?
I see. Yep. I see Dr. Osby's slide. Final cost of COVID, sickness, and death.
Okay. Thanks. Okay. I need to share this, and Dr. Osby has a lot of information for us. Okay, I hand it off to you.
Okay.
You have it?
Show my screen.
Uh-huh. Okay.
Okay. And is the screen up?
Yes, just put it in presentation mode.
Okay, there we go.
Beautiful.
Okay, wonderful. Everybody, I'm so happy to be here today. I'm so sorry I have to discuss this particular topic, but Rita and Vonda and I were just talking about when we first started thinking about this as a topic, and when I contacted Rita about maybe doing this topic, it was months and months and months ago, and we were debating back and forth when may be a good time for us to discuss this, and so we finally settled on December. We had no idea at that point how vital this information would end up being at that particular point. My perspective was, well, there are a lot of families dealing with COVID-19 and around sickness and death, but actually this is a topic that every family, every social service and human service provider needs to know, because you never know when you need to pass this information on to clients, the people you work with, your needed and your family. And people are still dying of things other than COVID-19. But just looking at the numbers this morning on CNN, they surpassed some of the numbers I even have in this particular presentation. So I really hope that this is something that you'll be able to pick up some information, that you can use in your own life, but also that you can pass on to people that you work with, co-workers, clients, whoever you come in contact with, because I just think this is information that people need to know. So again, my name is Dr. Olga Osby. I'm a co-managing partner with an agency called Clean Slate Behavioral Health Solutions, and I'm also an associate professor at Alcorn State University in the Department of Social Work. And I'm really grateful and thankful to Rita for inviting me back, and Vonna all the help. I love working with these ladies. And so while this is really stressful putting this together, I love doing this, and I love the work of the Center on Financial Social Work. So I'm really happy about being a part of this whole team. So to move on, I just want to, there we go, give a quick overview of this, what the session will be all about. I think you have some idea about what we're talking about, but these are some of the things I really want to kind of key in on. Looking at how families are coping with COVID-19, addressing some of the financial fear, grief, and loss that families are experiencing, to talk a little bit about what social service and human service professionals can do to assist financially strapped and grief-stricken families, how we can help them and help ourselves really in terms of our family members navigate the landmine of hospital and medical bills. I hope to provide you some recommendations for addressing the cause of sickness and death, and how to assist families to plan for those important financial and legal documents and matters that anytime they are dealing with any type of major illness and death, whether it's COVID, cancer, kidney issues, whatever family member may have. We all need to do that because, as the old saying goes, also, nothing's certain in this world except death and taxes. And so we know that at some point, this is going to come up in our lives, and we need to deal with this, okay? So December still seemed, even after Rita and I talked about when we would do this, a grim topic for what's supposed to be a really happy, joyful time of the year. But people are not feeling joyful and happy this time of the year this year. COVID has changed our world, and it has changed it in so many ways that we had no idea back when we first started getting an idea of what was happening, that COVID and this disease, this pandemic was out there, how much it was going to change our work, how we play, how we celebrate, how we worship. I haven't been inside of my church here in my hometown since March. How we interact with others, and most importantly, how we handle our finances. And this is really important because with so much of the economic uncertainty out there, and then the add what's happening around healthcare and the grief and loss in terms of losing family members, clients, friends, this has been quite a year. And so in a way, it feels like the Grinch has really stolen Christmas in a lot of ways. So this holiday season, COVID is most likely going to mean for most of us limiting or canceling plans to be with family. Holiday parties will end up being virtual. Most people are unlikely to travel or vacation. Financial uncertainty would mean fewer celebrations and gifts. And tragically, some loved one won't be at the table this for Christmas because we lost them to COVID. And with the numbers that we've seen, there's going to be a lot of hurt and a lot of pain this year for this Christmas season. So that's one of the things that, we just need to kind of prepare ourselves and kind of buckle ourselves for what's coming over the next several weeks and few months. So our grim reality is that we've been living with COVID in this world since December of 2019. So it's hard to believe that it's been a whole year ever since it was first recognized in Wuhan, China. Since January 2020, Johns Hopkins University's Coronavirus Resource Center has been tracking the growth of the virus. And it's been really interesting because if you watch CNN, I know for sure, that little box that they have on the screen, that comes from Johns Hopkins. So in real time, they're basically giving us updates in terms of the global cases. And I won't even bother to read these numbers right now because they've increased just since this morning. And I wrote this about 2 days ago. But the global cases have topped 67 million. United States is topped over 15 million. Global deaths are now over 1.5 million. And when I wrote this, the death total in the United States was at just over 283,000. But over the last 5 days, we've had 3,000 people per day who've passed away. That's astounding. And yesterday, it was noted that we lost more people in one day than we lost in 9/11. So this is something that is really impacting just about every aspect of our lives in this country and around the world. So COVID is now declared the leading cause of death in the United States. The Institute for Health Metrics and Evaluation at the University of Washington School of Medicine put this fact out just a few days ago, and that COVID now tops heart disease as the leading cause of death. And the other astounding statistic for me was that Americans are dying from COVID at a rate of 2 people per minute, not per hour, but 2 people per minute. And so if there's any good news that's coming out of this, is that there's finally a vaccine, 2 of them, as a matter of fact, that are under development. But the bad news is that just because there's a vaccine now and people are weighing whether or not to take it, like Rita's poll earlier, the fact of the matter is, for most of us, we won't see or have an opportunity to even take a vaccine until the end of spring, over into summer, and I'm betting that it's going to take most of the end of 2021 before we start seeing a mass scale of people feeling comfortable enough and there's enough vaccine to even go around to everybody. So there's a twofold thing there in terms of people saying, yes, I will take it, but also will there be enough for everyone who needs to take it as well? So the population's most at risk, and I think I'm pretty sure most of you join us today probably already recognize that race and ethnicity are playing a key factor in the underlying conditions of those who are most at risk. But from the CDC, they listed that the hardest hit by COVID were those who are low socioeconomic status, lacked access to health care, and worked in occupations less able to shield themselves from the virus, such as frontline workers, essential workers, and critical infrastructure workers. And this is really key because if you look in terms of those particular groups, you'll see those the people who are coming down and contracting the virus most, and particularly the essential workers, because they do not have the luxury of working from home. And my school is actually located in a rural community. And so rural communities are also being very hard hit with the coronavirus as well. And so this chart really looks at by race and ethnicity, who's contracting COVID as of November 30th, 2020. And so compared to white Americans, we look in terms of what's happening with American Indian, Asian, Black, African American, and Hispanic Americans. You can see that, there are some of these groups that definitely by race are being very hard hit right now in terms of this virus. And so within those groups, who's most at risk in terms of contracting COVID, where those are age 60 and above. The highest risk are those 85 and older. My 88-year-old mother lives with me, and I've been joking with friends that I've been wrapping her in bubble wrap if I have to take her out, because she is very high risk, but that's something that we have to think about in terms of what's happening with people as they get older. So those 50, people who are 60 have a higher chance of getting than those who are 50, 70 more than people who are 60. So it just goes up the ladder from that. And those with high blood pressure or type 2 diabetes have a higher risk. Those with a compromised immune system, those with lung and respiratory issues, those with heart problems, long-term kidney diseases. I have a lot of friends who are on kidney dialysis and have all sorts of kidney issues, waiting for kidney transplant. So that's been a major concern of mine for just people that I know personally. Those with cancer, those with obesity, and of course with the African-American community, another issue that's hitting them hard is the fact that those with sickle cell disease are also high here. I didn't know until putting this together that that was another group, but it makes a lot of sense when I thought about it. I'm like, oh yeah. So that's another reason why we're seeing this at a higher rate within the African American community as well. So COVID's impact on the family and the household. We all know that, there was a stimulus package that was passed, in the late spring or over the summer. And there were certain measures that were put in place through the Congress. But those measures are about to expire. They were only temporary. And so the unemployment, the increase in unemployment checks, the moratorium on evictions, as of December 26th, unless there's something that comes out of Congress within the next few days, those things are going to expire. And so people I know who are dealing with homelessness, because I used to work in that community as well, they're really expecting another huge wave of people being evicted and the homeless numbers going up. And the impact of COVID has had enormous economic fallout, particularly for Black, Latino, Native American, and immigrant households. The pandemic has exposed the historically harsh realities for poor and minority communities when it comes to education, employment, housing, and health disparities as a result of longstanding structural racism. One of the issues that I think will be with us long term is what's happening educationally, because kids, whether they were in urban communities or some of the rural communities, going to remote education has been devastating for these children. So that's going to set them back. And I'm really concerned about whether or not down the road that's going to lead to massive dropout as well, which will impact our labor force and will impact their life outcomes as well. So there's just a ripple effect that I think that this pandemic is going to have for us down the road. So there's another particular good website that I wanted to point out, and that's from the Center on Budget and Policy Priorities. They're tracking the extent of the hardship in real-time data. And they're looking at the effects of COVID on food, housing, and employment. And one of the things that I like about it, particularly for those of you who may be researchers or doing things for your job around writing grants around assisting with COVID, they even have state-by-state analysis. So that's going to be really helpful for people who are looking at this. And as I said, it's real-time data. And just to give you some ideas of the kind of data that they're using or they're putting out there. Oh, I'm sorry. I'm going to do a poll. I'm going to look ahead. This is one of the things that I definitely wanted to bring up when it comes to this, and I'll get back to some of that data in just a moment. But the poll here is how many more women dropped out of the labor force by September 2020 versus men due to COVID-19. So I'm going to go down here and open up the poll. And launch it. Okay, and let's see how people are responding to this. Okay, give about 60, almost 70%. If we can get up to 80%, maybe we can do that. Okay, look, about 73% of people have voted. So let's go from there. But I don't know, is it coming up that people can see the results of the poll?
No, have you closed the poll?
Oh, close it, okay.
And then share your results.
Okay.
There you go.
All right, great. Okay, so if you can see in terms of twice as many, 3 times as many, 4 times as many, and 5 times as many, and that's interesting, a tie between 3 times as many and 4 times as many. The answer is actually 4 times as many. So 4 times as many women have dropped out of the labor force by September 2020 versus males. And I really wanted to bring that up because one of the things that I've been reading a lot about around economic insecurity has, particularly in light of COVID, is the impact it's had on women. And so this has been devastating for women in the workforce because they're the ones who've had to come out. You think about the fact that they needed to come out because they have to stay home, take care of children who are remote learning, healthcare concerns, because they lost their jobs. I mean, there's just so many reasons for why women have had to drop out of the labor force at this time, but it's been absolutely devastating for women, okay? So thank you all for participating in terms of that. And so I'm going to hide this. Okay. Okay, it should be closed out now, right?
Right.
Okay, great. So I can move on. Okay, so yes, I definitely wanted to share that in terms of what's happening with women. But from that Center on Budget and Policy Priorities, I just want to show you some of the data that they're collecting and how interesting it is, and particularly since they're doing this in terms of real term. You can see at the bottom of this first chart that looks at Black and Latino households likelier to experience food insecurity during the pandemic. And so, they have this chart out in terms of looking at the fact that, by race and ethnicity, these are the two groups that are dealing with this the most. And the source coming from the Institute table was as of November 11th through the 23rd, 2020. So that's really up-to-date recent data. The other piece that I thought was really interesting but also heartbreaking is that for 1 in 6 adults with children, households lacked sufficient food in the last 7 days. And so, we see that families with children are experiencing a great deal of hunger. And for those of us who are news junkies and watching the news, we see a lot in terms of food lines that really ravel the nerves in terms of what we're seeing, those long lines of people. And usually when you see the cars, there are children in there. So it's really disheartening in terms of what's happening and how children are suffering through this pandemic. The other one that I thought was interesting was COVID and housing insecurity, because particularly since having dealt with and worked in homelessness, really key in terms of what's happening with families in terms of being able to be housing secure. And so this first chart, we see 1 in 6 renters not caught up on rent during the pandemic, with Black renters facing greatest hardships. And so it's interesting to just look at the statistics in terms of knowing where may need to apply aid. And then the second chart, that nearly 1 in 4 renters living with children are not caught up on rent. And so come the end of this month, in January, February, that's going to be another huge issue in terms of children and homelessness as well. Okay, and then this last one coming from the Center on Budget and Policy Priorities just looks at the fact that the job losses have been hardest on low-wage workers. And that's a real, really depressing issue in terms of what's happening with low-wage workers who are already suffering before the pandemic. Now we see that, again, a lot of the burden in terms of what's happening is falling on their shoulders as well. So I just thought that these were some interesting pieces. So if you're looking in terms of doing some research, that's a great website to go to. And so the shock to the system in terms of the medical costs of COVID, and this really gets to the heart of some of the things I want to discuss about this, because it's one thing in terms of just dealing with the financial losses and being concerned about whether or not you'll have a roof over your head. If a family member comes down with COVID, then there are steep medical bills that may have to be confronted as well. And in this country, we've had real serious concerns about health care, particularly those Americans that were out health insurance. but also those who were living, had really high deductibles, and those who had to contend with an assortment of health disparities and health issues. This has been a major concern in this country for quite some time, ever since we started in the Obama administration, really debating about what to do about, healthcare. This has been an issue, but COVID has really kind of ripped the sheets off of a lot of things that we've been covering up and just not talking about in terms of this. So many families are now incurring really high out-of-pocket medical costs during the worst economic crisis that this country's ever had. And while it's been really devastating on the healthcare system, employers, and insurance, it's been devastating for families without healthcare coverage. And so going to the last, this is my second poll, which is how many workers have likely lost their employer-provided insurance due to COVID. And this is one I think is really interesting as well. So I'll give you a second to really think about this. Okay, about 30% of people voted. Very interesting numbers coming up. Okay, about 65. Give a few more people. Okay. Let's see, the number's going to increase. Okay, about 69 of you voted. Okay. All right, can everyone see the numbers there? Vonda, I need to close it?
Yes.
Yes.
Okay. Okay. All right. So you're really very close in terms of looking at.
I think you have to share it.
Oh, I'm sorry. Yep, still a newbie at this. Okay. All right. If you can see the poll results there, that 33% said 3.5 million, 39% 4.5 million. Really close. The actual number, the number of people that they're estimating have lost their employment provided health insurance is actually 3.5 million. So 33% of you are right on target with that. And I think that this is going to be an interesting policy issue during President-elect Biden's term as he comes in and start talking about health coverage, because before COVID, 49% of all American workers depended on employer-provided health insurance. So what's happened with that 3.5 in addition now, who've lost that employer-provided healthcare insurance because of COVID? And it's going to take a while for people to get back on their feet in terms of getting another job that provides the type of insurance that they're going to need. So that's going to be another, policy issue, I think, that will be definitely on the table coming in with the new administration as well. So I'm going to go ahead and hide this and close this out. Okay. All right. Thank you for doing that one. Okay, and so moving on, I want to talk about and share with you all a conversation I had with someone who works at a hospital in the Atlanta area. And this is a young man who is a patient account analyst. And he shared with me some of the things that were happening with his hospital with both insured and uninsured patients who are experiencing COVID-related medical costs. And so I thought it was really interesting, some of the perspectives and some things that I think you all can share as well, at work and with, friends and family as well. That the average length of stay in the hospital with COVID-related symptoms is 1 to 5 days. But that's not including when people need extensive ICU treatment. And of course, the insurance, if they have are insured, the insurance typically covers 80% until the deductibles met, and then they pick up the 100%. And copays may vary depending on the patient's insurance plan. But one of the things that I was concerned about was what happens in terms of out-of-network care. I was hearing a lot about people who had, once the hospitals were full and they couldn't treat the person there, and they had to send them to another hospital. Sometimes that was out-of-network. One of the things he told me was that if a patient has to transfer for out-of-network care, they or a family member must be notified due to the potential for a drastic increase in costs. And, that's one of the things that's been a major concern, and some of the things I've been hearing about what families have had to deal with that in terms of family members who've had to be transferred to other hospitals because the hospital in their area was full and they just couldn't take any more patients. But he did say that, however, if a patient is admitted to an inpatient room by the ER, that the insurance must cover the patient under the in-network benefits and rate. Okay. And that for military veterans who are uninsured, that they can seek treatment at a VA hospital as long as they've received an honorable discharge, that FEMA has been authorized to provide services in relations to public health, but doesn't cover or supplement costs for individual medical bills, and that Medicare and Medicaid both provide comprehensive coverage for patients affected by COVID. And he stated that hospitals did receive some of the stimulus money, but that was basically to help them cover some of the balances on their books and to supplement their lost revenue. But this was a really interesting quote from him that I thought was really right on point in terms of what these families are experiencing. He said that COVID has disproportionately affected people of color because of a number of factors. Employment does not allow a work from home option, or the fact that they're in multi-generational families living in the home. So even if grandma's living at the home, someone goes out and comes back in, they may bring COVID back home with them. And he said that because of those factors, the cost of hospitalization has left many people of color fighting for their financial lives. And I think that that really sums up what's happening with a lot of people right now, that they're fighting for their financial life. So after hospital, what happens when the patient goes home? There's still, a great deal of expense that family members have to cover. I was reading this interesting article of a family in Washington, D.C., who shared their experience when the father, the patriarch of the family, contracted COVID and arrived home, and the continuing costs that they incurred from that. The son was saying that, his dad's medications were $75 and up per prescription, that because he had been on a ventilator and he needed continuing oxygen therapy, they had to buy that for home use, and that was $1,700. That the nurse suggested that because he was used to being able to sit up and that helped with his breathing as well, that he really needed an adjustable bed. I don't know if you've priced adjustable beds, but they are really expensive. And so that cost the family another $1,400. And so the family reported they spent out of pocket over $6,300 on medical supplies, medications, outpatient office visits, household needs, and food in 1 month. $6,300. That's staggering, and that would be just totally cost prohibitive for a lot of families. And how much individuals and families can have to pay for those long-term COVID healthcare really depends on how long those symptoms may linger in terms of the health, because there is such a thing as long haulers, where they talk about the fact that some of these symptoms of COVID will be with them for months, years, and they're not even sure how long, since this virus is so new, and trying to understand what people may have down the road that they'll have to contend with. Okay. And so after, dealing with, the sickness, and, families are lucky enough to get over that and deal with, COVID in terms of the long-term care needs. Some families weren't so lucky. They lost family members. And this is another issue that I thought was really important that we address as well, that second wave of COVID in terms of the financial trauma, because the death has really taken these families, by storm, and it's been enormous and persistent in terms of the numbers. The Kaiser Foundation reports that for every person who dies of COVID, 9 close family members are impacted. And because of the way Black and Hispanic families may be structured, maybe even more family members than that. And so these families have been traumatized from the rapid decline in health of their loved one, the sudden death, and the inability to be with their loved ones when they pass. They haven't been able to really gather with family and friends for traditional wakes, funerals, repasts, which is huge in the African American community, I know, all critical parts of that whole healing process that families need to go through. And so they talk now about secondary victims of COVID, and that how many of these families have lost, their primary sources of financial, social, and caregiving support. And the bereavement from COVID-19 has the potential to, lower educational achievement among youth, disrupt families prematurely in generational lines of families, and poor physical and mental health across all age groups. So these are long-term things that we're going to see. And Holly Pregerson, who's with this End of Life Care Center, had a quote that I also like, where she says that bereaved individuals have become the secondary victims of COVID-19, reporting severe symptoms of traumatic stress, including helplessness, horror, anxiety, sadness, anger, guilt, and the regret, all of which magnify their grief. And so there's a really emotional cost of funeral planning, that, you're going through all of these emotional issues and dealing with the loss and the shock of, someone. And so in that state, these families are walking in and having to plan a funeral. And this is where it really gets down to, some of the financial decisions that have to be made at this particular time. So it's not uncommon for families to overspend for a funeral by hundreds, even thousands of dollars. And some of the common reasons for that is that families are engaged in emotional spending. People want to be able to put their loved ones away well. And they're pressing time constraints that often happen because, and particularly now with funeral homes having back-to-back funerals and burials. I just passed a cemetery that's not far from my home on a Tuesday, and they were having 3 burials at one time. And pre-COVID, I never saw that. I mean, you see on Saturdays maybe 1 or 2 burials, but there were 3 of them taking place at one time. There are many on-the-spot decisions that are being made. Most family people planning a funeral have no prior experience of funeral planning, so they're walking into these funeral homes and they have no idea what to expect. Some family funeral homes and cemeteries, surprise, surprise, will take advantage of the situation and in the family. And before the families realize it, that they really could and should ask about an itemized list of charges and go do that. And yes, you can say no, or decide what you want and what you may not want, or to shop around with different funeral homes. They've spent $9,000 to $15,000 on a funeral easily. And I've witnessed that happen in terms of having buried my father, my oldest brother, and my older brother, because there was only 3 of us in the family. So I've lost both my brothers and have had to, participate in or plan their funerals, and my dad. So I've seen this happen on so many different levels in terms of what happened. And most people have no idea how much really goes into, determining the fees for a funeral. And these are just a few things I wanted to highlight in terms of what's happening with the cost of the funeral. First of all, when you walk in, there's a basic, service fee for every funeral home, and this is non-negotiable. And that's going to range between $2,100 to $2,500, depending on the funeral home. There's transportation of the remains to the funeral home. That can run anywhere from $325 to $400. And let me say one other thing about transportation. You have to think in terms of every time they move the loved one from one place to another, there's an additional cost. When my brother passed in May of 2019, he lived in the Atlanta area, but he wanted to be buried next to our oldest brother in Louisiana in our family cemetery. So the extra fee for our family was to fly the body from Atlanta to the nearest airport that they could land him was here in Jackson, Mississippi, ironically. And then the funeral home in Louisiana had to come over and pick him up here and take him there. That's extra cost. And, you know, most people don't even think about that. It's emotional that, oh, he wanted to be buried next to our brother. He wanted to be back home. But, you know, can you afford to do that? And that's going to be another emotional tug for families as well. Then there's the embalming fee of $750 to $800, depending on the funeral home. You have to think about makeup, hairstyling, and dressing. A lot of people have no idea, but there's a fee to that as well. There's the hearse and service car. And yes, you're going to have the hearse, most likely in terms of transporting the body from, you know, funeral home, church, or then to the burial site. The service car, on the other hand, you know, can run anywhere from $150 and up per car. And so sometimes I see these families that have like 2, 3, 4 cars of family members where they go to the family's home, take them to the funeral home or to wherever the funeral is going to be, and to the burial site. I learned after my dad's funeral, I got a car I can drive myself, okay? And just to be honest with you, kind of thinking about, you know, where you can save some money, because that can be the difference between $150 to $600, depending on how many of those cars a family may get. But of course, the family wants to stay together, and so they have to think about that, but, you know, think about the cost that's incurred in terms of that as well. And the biggest cost for the funeral is usually the casket. And the casket can run anywhere from $2,000 to $10,000. And, you know, I shared, I called my sister-in-law to ask if she mind if I shared this particular story, because I thought it was just, you know, so poignant in terms of what happens when you're in a funeral home and you're going through the emotion. I was with my sister-in-law and my nephews when, you know, we were planning the funeral at the funeral home, and then they take us into the casket room. And you would just want to fall apart at that particular point. And so we were right next to the funeral home director, and he leads us over to this casket. He goes, and here is our Cadillac of caskets. And the thing was about $10,000. And my sister-in-law, out of the midst of all her grief and pain over the sudden death of you know, my brother, her husband, I saw her snap out of that for just a second and look at him and go, my husband did not drive a Cadillac in life. He's not going to lay in one for the rest of eternity. And then my nephew goes, well, you know, Mom, they sell caskets on Amazon. I've never seen prices drop that quickly before, you know, and we laugh about that now because, you know, that's a very emotional laden experience of, you know, am I being cheap if I'm laying my loved one away that way? But the thing is, good caskets do not have to cost $10,000. There are markups on this. And if families aren't aware of the fact that that's an emotional buy, that can be, you know, detrimental financially for the family. So that's something else that people need to think about and walk in knowing that need to think about that.
Olga,
yes.
we are running out of time.
Okay. Then let me just run through a couple of these, and I'll try to get through these because these will be up. Helping families cope with funeral costs. You can go in and see what happens in terms of if you have income in terms of doing this, and if you don't. One of the main things I wanted to ring about this is that crowdsourcing has become a major way of families dealing with, you know, paying for funerals. You know, the two pictures here are a picture of people who have died of COVID, and their family and the community got together and crowdsourced on GoFundMe as well. And that's a very emotional decision to ask for help, but oftentimes families really need to do that. And then we start looking at pre-planning for sickness and death. You know, you're talking about confronting the uncomfortable, how important it is for families to sit down and start thinking about the what ifs and the end of life care, and the fact that they need to form a plan, that they need to inform family members about how to locate relevant information that they may have, and clearly write out their wishes. All of that needs to be done beforehand. And so I guess we won't have time for this one particular poll. So I'm just going to go through and give you the answer in terms of this one. That according to the National Funeral Directors Association, what percentage of Americans aged 18 to 39 think that people should pre-plan their funerals? And actually, for that young age group, 15.8% of them believe that it's really important before you're age 40 that you pre-plan your funeral. And which is interesting because only 7.9% of people over the age of 60 think it's important for you to pre-plan your funeral. And so I thought that was really, that age gap difference is really interesting. So some of the other issues about pre-planning for you to keep in mind: keep a list of your finances, sources of income, insurance policies, retirement funds, all of those things that, people need to, someone may need to go in and find right away, either for yourself or for a loved one that you need to keep for a loved one. List up-to-date social media, email, and any accounts with logins and passwords. Make sure that there are P.O. box numbers. And the key, when my oldest brother passed away, we lost his mail because we didn't have his P.O. box number, and it took so long to go through probate court that we lost all of that. And make sure they have Social Security numbers and all of that. Write or make notes for obituaries and family and funeral service plans. Get that done early. I did that with my dad, and that was such a relief having that before he passed away. Decide what you want done with your remains, whether you have a funeral or a burial, cremation. Save some money and put some money aside for your immediate funeral burial. And there's such a thing, you may want to ask your bank about payable on death or transfer on death accounts. These are really new things that I had never heard of those. And so I'm going to ask my bank about that. And then again, shop around for funeral home costs and pick out your casket. And then the last thing, and this is just a good list that if you can go back and look at this, there's some of the financial and legal documents that you may need to have. Guardianship documents if you have children, healthcare power of attorney, financial power of attorney, living will or advance directive, do not resuscitate or do not incubate orders. Your last will and testament is really important. Organ donation, that could be a major issue, and so ask ahead of time. Life insurance, and that life insurance policy, if you do not have children, can be really important in terms of helping with your own burial as well. Trust related to property and family assets that should be known and available. Personal property memorandum, that's just writing out a note about who you want to have what of your personal property. Digital asset memorandum is a new one as well. That's who you want to have access to your social media, your email accounts, your Facebook account, all of that should be spelled out, and that person have the login and passwords. And to keep these documents and copies with someone that you trust is the main thing, that someone should be able to go in and know exactly where you keep these items, or they have copies of them already. So sorry about, I am long-winded. I want to read about that, but for having me today, and I hope that you're able to pick up something that will help you down the line in terms of this as well. Okay. All right, so Rita, I'm going to send this back over to you, okay?
Okay.
There you go.
Okay. Olga, can you stay a few minutes to answer some questions?
Yes, definitely.
Okay, because I'm sure we have questions. I'm sorry I had to start rushing you at the end, but some people have to leave and get back to work. So,
oh, I definitely understand.
Okay, everybody, thank you. That was so much information. It was just wonderful, and people will be able to watch that ending there where we had to rush a little to be able to just focus on all of those materials once that recording is up. I did want to share with everyone that next month we have a webinar different than any we've ever done. And we're going to have graduates of financial social work present to answer your questions and to tell you all the new and exciting things coming from Center for Financial Social Work. So we call it financial behavioral health for you and your clients. And these are our new financial social work advocates, and you can learn more about that next month. It's on January 14th, and you can register at financialsocialwork.com right now. We do have a certification. It includes 20 CEUs from the National Association of Social Workers. It is a self-study and self-paced program. Our students have 6 months to complete it, and a 2-week online open book exam. We also have a payment plan available. So in closing, I'm going to say that, remind you that our slides aren't shared. The recording will be on our website within the next few days. And there are no CEs or certificates of attendance for this webinar, unfortunately. So, Vonda, do you have some questions for us?
I have a few, not very many, although Dr. Osby, a lot of people are really grateful and thought the presentation was really great. We got a lot of people raising their hands, but it's just best, Rita, I think if people just put the questions in the chat box, because we don't, unmute and, give people the permissions to speak over their mic. But a lot of people are raising their hands. So we did have a question for, where is it? Let me get back up here. Well, this is a comment. Someone said that they used to think that pre-planning was a scam until they worked for hospice and then a couple of funeral homes. And now they see it as a major gift to the family to have planned ahead and have the hard conversations.
Mm-hmm. I do
There
agree.
is, okay, I'm sorry. No, go ahead.
No, that's all I'm saying. Yeah.
We had someone that said they wish that you would have talked about solutions for much longer than the problem. I know that's kind of vague, but that's what they typed in.
Mm-hmm, mm-hmm. Yeah, I understand that because I regret that I didn't have a chance to go into a little bit more depth in terms of some of the things that they could do, but I really hope that we'll be able to, kind of keep this conversation going in a lot of ways as well, because this is something that people will definitely be continually confronted with. And particularly in terms of knowing and understanding the documents that out there that will make your life so much easier if you have those things done beforehand. And dealing with an 88-year-old mom, I recognize how important it is to have some of these documents and certain things that didn't take place in families that, people need to sit down and discuss with each other, and or somebody needs to take the reins and control over.
Thank you. We do have a question, and it reads, how are mental health costs and outlays factoring into national and regional costs of COVID to deal with the emotional cost you spoke about?
Oh, I think that's an excellent question because too often mental health care is not giving the amount of attention that it needs versus physical illnesses and pain. And this is clearly an issue that will have major mental health implications. Some of the side effects of COVID, they're recognizing will have some mental health effects. So I think that insurance companies may have to look in terms of, for those who have coverage, how to handle that. But I worry about people who are uninsured, who are dealing with the strain, the trauma, all of this, whether or not, like in the state of Mississippi, we have regional mental health services that, are really pretty good dealing with things, like major mental health illnesses, but we're looking now in terms of just the emotional strain. And I'll share one thing that the city of Jackson is doing, which I think is wonderful. In Jackson, Mississippi, a group of social workers came together and they formed what is called a warm line, where, people can call and talk about some of the mental health issues that they're experiencing due to COVID. And the social workers will refer them over to a list of providers that have stated that they would take in and work with people who are suffering and having difficulty around COVID-related mental health issues. So it depends on what's happening in the community. That particular line started out of the mayor's office in Jackson, Mississippi. And I know quite a few of the social workers, and I've even volunteered on that line as well. So people have to kind of look around and see, how people are getting together to try to address these issues for people who may not be insured and having real difficulty with this.
Thank you. Question reads, for instance, if we're providing COVID testing, should we also maybe make a point of having a sign in the lobby or adding something to sign-in sheets that encourages patients to meet with the social worker if they've been economically impacted by COVID and, or want to plan in case of sickness?
That sounds like a great idea. So I think that, again, that depends on the places that's involved in terms of this, dealing with this. But I really believe that people who are experiencing this grief and loss and pain from this really should seek mental health services from a social worker or any other counselor that they should be referred over. So I don't know if that addresses the question, but that's something I think definitely should happen. And I know quite a few social workers who are really trying to put themselves out there and make themselves available for that.
Okay. Rita, do you want to continue?
Sure. Thanks. Oh,
okay.
Yeah, one or two more.
Okay. Question is, I would be interested to know more about those whose jobs were affected by COVID and whether they pursued Obamacare and or Medicaid when their income changed.
Yeah, and I think that depends on where they may live. I can just give an example from the state of Mississippi. We did not go into Medicare and participate in Medicaid expansion. And that's hurt the state tremendously with COVID, and particularly in a lot of our rural areas. So I think what's available and what people are able to really access really depend on where they live and some of the resources that may be available. So I think that's a difficult one, but that's one that I'm thinking moving forward that we're really going to have to do some advocacy work around that in terms of opening that up for people down the line.
Okay.
Okay, last one, Vonda. Is there one?
Well, I am, hold on, I'm looking, they always come in at the last minute. Let's see. Another question I have is if you have advice for social workers in urgent care settings, how do you suggest introducing the information or prioritizing what is discussed with patients when there's not much time given the context?
That's a good question. Because I think that this is information that people really need to know. The young man I was talking to at the hospital in Atlanta, and I didn't mention, which hospital for his confidentiality, but when I was explaining him what we're doing and about financial social work, he was really interested and wanted to share this information with the social service staff at his hospital because he said that, this is something that in his area where they're dealing with both insured and uninsured patients, that they really need to have access to this information. And, it's something that even the social work staff sometimes may not be fully aware and conscious in terms of, what to do around financial social work issues. So this is something that, I think we'll need to think about, but I'm like Rita on a mission to try to get this information out there as much as possible. And I think that definitely in terms of insurance, because the way he was describing, he gets a lot of information, questions from patients, families about how to cover certain things, and then dealing with things on the other end too, in terms of the patient passes away.
I think we probably, I think at the very least, there should be some kind of brochure or handout, which we all know isn't the greatest solution, but we should have a way to sensitively and compassionately provide the basics of what to expect. Your one slide, Olga, was on the funeral expenses. I think we should have started with your last few slides, because that just held a tremendous amount of information that fascinated me, where people don't know how they're likely to be so exploited when they go into the funeral parlor company. So maybe we have to do something a little more on this again in the future, Olga. I would like to thank you so very much. Thank you, Vonda. Thanks, everyone, for joining us. I hope we'll see you back here in the future. Stay well, everyone, and have a beautiful rest of the day.
All right. Thank you.
Thank you.
Bye, Dr. Osby. Bye, everyone.
Bye-bye.